What are some best practices for post-operative care from the OD?
Yeah, the interesting thing about CTAK is, it's a minimally invasive procedure, right? Essentially, what you're doing is you're creating a, intracorneal channel, and they are sliding the CTAK tissue into that channel. So this is a intrastromal anterior lamellar keratoplasty, or a form of that. So what you're seeing on these individuals is, because this is done in the channel and the way that the procedure is designed, most of these patients are not going to come in wearing a bandage lens. They're not even going to come in with a suture in the eye. So it's actually a very simple post-operative on this. It's actually quite a bit more like refractive surgery post-operative care.
Right, makes sense.
Particularly in LASIK or SMILE, versus like a PRK or a cross-linking, right? So generally what we're looking at the 1 week follow-up is just to see, is the tissue deturgescing? Are there any obvious signs of complications, so any infiltrates, or anything that would indicate a problem? Are we identifying that there's a channel tear or unusual swelling or anything like that? But by and large, it's pretty simple. What we do is day one, just make sure there's no gross complications. Most individuals on day one will see a large improvement in their visual acuity. It's actually quite fun. It's the closest I've ever seen to a LASIK wow factor in the keratoconic population. It's very impactful. It's ballpark, kind of like when you put a contact lens on these patients, where they'll go, wow, my vision's so much better. So day 5 follow-up is basically, again, kind of making sure that the treatment is, or rather the healing course, is going the correct way. You're seeing some, deswelling of the corneal tissue. Normal to see that level of edema on day 1. It's what we'd expect. Day 5, we should see that that's starting to reduce. The tissue is becoming a little more clear, a little less swollen. And, from there, you're kind of adjusting your drops. We treat this almost exactly like a LASIK, PRK, cross-linking as far as the post-operative drops. So you're discontinuing your antibiotic. You're going ahead and continuing on your steroid on the taper for the 4 weeks, and then follow up at a 1 month mark. And at that point, at 1 month, and sometimes even sooner, we will either restart a contact lens fitting process, or what we'll do is we'll go ahead and resume contact lens wear. If you are wearing a scleral lens, the cornea doesn't change, rather, because the cornea is being vaulted, the scleral lens may not need to be changed all that much in its parameter. So you can really use the same fit that you have and just update your optics.
Okay.
Whereas in anything that's resting on the cornea, so corneal gas perm, a soft lens, a GP, a piggyback or a hybrid, those need to be entirely refit, because CTAK can provide dramatic change to the corneal contour. So those lenses definitely won't fit. So at that point, you can start exploring that. But if they're going to go into a soft lens or a scleral lens, I've started patients back in their lenses at the 3 week mark. So generally, I say wait until the 1 month, make sure that the cornea looks good, and then go ahead and start the contact lens process. So it's it's huge for patients. It's just so impactful.